Hi everyone. The reason we are having this video done is, this is Vasavi, and she was one of the most skeptical patients I've ever seen for any kind of dental treatment. So this is all about her and how she slowly moved from being so skeptical about having any treatment done to the most cooperative patients over a period of 6 months. And I think this makes her a very special patient for me, in spite of having a 20 years of experience, because we literally worked end to end. I think we provided her whatever was needed for her, including a tooth jewel at the end. So Vasavi, let's get knowing. What made dentistry so fearful to you?
One main thing is I have a very low threshold for pain, and the very first time when I visited a dentist, this was like almost 20 years ago, it wasn't a very good experience for me. It was quite painful, of course, and it was for a root canal treatment, and then I wasn't sure if I want to go through it again. So I was trying to maintain a good oral hygiene, and that ruined further. And I had a lot more issues to begin with, and then I tried seeking help, and I went to other dentists as well. So one thing is, mostly I think doctors would think that I need to treat this particular whatever concern is there, and then we are done with it. I think at least with the people that I went to, that's what happened. And it's only when I came to Dentacare is when I realized that you're just not thinking that let me fix the issue, whatever is there. You want to understand the patient.
Correct.
And then you give me that enough time to process it. And even when I'm going through pain or anything at all, it's like the slightest movement in my body, you would sense it and you just stop. And then you tell me what exactly you're doing and how much deep you would be drilling or whatever you're doing. I don't know if I'm using the right term. Right?
Correct.
So whatever you're doing, you would tell me this is how much I would be doing, You wouldn't underestimate me thinking that because she doesn't have any idea about dentistry, so why do I care explaining her? You were never like that. You're like, okay, the patient needs to know what they're going through.
Correct.
And then you would give me all the necessary information. Of course, not bombard me with all your jargons. So you would give me the necessary information which would prepare me. I remember I think the first time I came, I'm sure even you remember how many people had to hold me.
Truly. That was so much like treating a pedo patient for us,
Yes, absolutely. So I think when I would go back home and I would tell, my children would tell me that the last thing that the dentist had to do is crucify you to the chair. That was one thing that was left. When I tell them somebody was holding my legs and somebody held my hands, right? But then you never gave up on me. It was very easy for you to say, okay, let me just fix this and send her away. Because not everything was visible, right? Not all the problems were visible and not everything was hurting me. But if left unattended, it definitely would have led to much more complications and, more painful experience I would have had. So you explain me that.
Here I'll just tell you, see, dentistry, 90% of us think that it is treating a single tooth, right? So what normally happens is you treat a single tooth, you correct that bite, you allow the patient to go, okay? But according to me, what I really feel is, dental is a whole set of 32 teeth, okay? So they all need to work in synchronization with each other.
Yes.
Okay, here if you don't have synchronization, in the sense, the patient will automatically shift his biting from one side to another. Okay, why I would explain to you why you need to set right all of your teeth is, I want to preserve the restorations what I have done on you.
Yes.
Okay, and my issue is very, I want to give you the best. Okay,
Yes.
That was the only reason I told you, let's fix everything so that you don't have to keep visiting a dentist, but you just have to come here for a checkup once in a year.
Absolutely.
That's it.
Yeah, that was very much evident, when you would say, it's very easy for you to just do a root canal and give me a crown.
Yeah.
But you're like, no, let us try to save that tooth as much as possible, maybe give an inlay or something like that. And then, save it as much as possible, because one, we don't know what is right.
Right.
And whatever you say, I'll have to, believe that. And then it's very easy for you to take advantage of the situation, which you never did. And I'm so glad, and I feel every time I would come to Dentacare, I'm like, I'm so blessed that I found this clinic. I don't know what would have happened otherwise, because I think just 6 months before I could come to Dentacare, I had visited a dentist. It isn't like I haven't.
Okay.
But yeah, it wouldn't be fair to take their name.
Yeah.
But yeah, because that dentist could not do a good job, then I had to shift the bite. And then, as you rightly said, I was chewing only on one side, and that created a lot of problem. And in the middle of the night, I had like excruciating pain. I didn't know what to do, and I don't do self-medication. And that's when I got to know about you. And then the person who recommended said, she is the perfect dentist for you, and you are the perfect dentist for me. I don't think I could have had anybody else who could have like fitted so well in my life. Yes.
No, see, about you, if I have to tell, right? See, there are so many patients whom we end up treating, but I feel as humans, we lack the grateful feeling, right? But treating you was very easy because you were so grateful. Though you cried, though you did, you shouted, but you were so grateful at the end of the day. See, that puts us as professionals into a good space. Okay, we know that. See, 100% of us, we don't want to give pain to our patients, right? We want to be as painless as possible, right? Yes. But when the patient is grateful, that gives us a lot of responsibility to do our work the right way. I think that is what made you a very, very unique patient to me, and that's why I wanted to share it with our audience and our viewers also. How some patients just touch our heart, okay, and they remain with us.
Wow, that's awesome. Thank you. From my experience, what I have learned is, the more the delay, more the problems. And we all think that getting into a dental clinic means it's like a big cut in your purse. It's not the case. Dentistry is not expensive. Neglect is.